So I'll be recording this class. I hope I'm audible to you guys. So are you guys okay? So you guys can see my screen, yeah?
Yet we can see it.
Okay. I'll just share my screen. All right. Just go to my notes and we'll start a note. Okay. So this is basically a orientation class for MRCPCH Part 1 exam of February. I'll just give a short introduction because some of you are like new, you're absolute beginners, maybe you don't have any idea about the exam. So what is MRCPCH? Mainly it is the membership of Royal College of Pediatrics and Child Health. Okay. So once it has 3 parts, once you pass all 3 parts, you'll get the membership of the Royal College of Pediatrics and Child Health of UK. That means you will become a registered doctor there, plus you can get entry in the ST4 level. ST4 level means specialized trainee level, or if you want, you can join as a registrar. Okay, this is for the UK, and if you complete all the parts, that is part 1, 2, 3, you can get after plus 3 years experience, you will be allowed to become a consultant in the Middle East, especially I can say about UK, UAE here. After MRCPCH plus 3 years experience, once you clear the exam, there is a specialization exam, which is okay, which is not very much tough. You can clear the exam and become a consultant here. Okay, that is the basic. Now, for our 6-month batch, now you have any questions related to this, how the exams are conducted, or any idea you want me to share? Okay. So our exam is about MRCPCH part 1, right? So part 1 consists of mainly A and B parts. The A part is FOP, the B part is TAS. Is my screen visible to you guys? The whiteboard?
Yes. Yeah,
okay.
yeah, it's visible.
So FOP is basically known as, FOP is the short form for Foundation of Practice, okay? And TAS is the short form of Theory and Science. So these 2 exams are basically independent of each other, even though they are part 1, but you have to pass both these exams separately. You can take the exams on the same day, or you can take exam on different session. Maybe in February, you're giving only FOP, then in June, in the next session, you go for TAS, okay? It is independent of each other. You have to pass them separately. So the foundation of practice is basically all the clinical related stuff, okay? Theory and science is all the anatomy, then we have the physiology, then we have pathology, then some amount of, we have a very tiny amount of embryology, all the basic things is theory and science. All right. So this one is a 6-month batch. Are you guys clear with this?
Yes.
Yeah.
This is a 6-month batch. Our batch is a 6 months batch. So we are going to start from today and we'll discuss the layout. Okay. So before discussing layout, I wanted to show I wanted you to have a very clear idea of what you're getting into. When will you plan for exam? You should have a clear target. If you do not have the target, then it's of no use. You're wasting your money, you're wasting your time, you're wasting like a lot of energy into nothing. So you should have a very clear idea that what I'm getting into, and you should have a sort of target, strong target, because 6 months plus along with you have joined a coaching, it should be very much enough to make you pass smoothly. Okay, but it is a 50-50 thing. So I give my 50, you give your 50, otherwise it's not possible, because when you pass, the credit is completely yours. It is not because of anybody, not because of me or anybody, it is completely yours. So you should own it. Okay, so for 6 months, how are we planning is that The classes are designed that it will combine, I'm combining both the FOP and TAS portions. Okay. And the classes will be, as you know, Saturday and Sunday, 5 to 8 p.m. UAE time. Since we have students from a lot of countries, please convert into your local time. After the class, you will receive the PDF copy, okay, plus the recording. The recording will be available to you till your exams and you'll be given access. So if you are not available around this time, you can easily go and you can watch the recording whenever it is possible.
Tamina, Ali Rahman is asking to let him in.
Okay, thank you so much for informing. Okay, there's a lot of people waiting. The reason I was not allowing a lot of people is because they don't have the real name.
You will have to put in group that they need to.
Yeah, I'll just allow everybody for now and I'll ask them because even if I say, they do not respond. That's the whole thing.
Actually, I'm new to Zoom and I've created the account right now and it gave a default username. Unless you told me, I didn't go to the settings and change my name.
Okay.
So I think that also needs to be mentioned.
Yeah. Could be.
Yes.
But then at least you should like, thank you for responding. At least you are responding because it's like, it becomes a bit tough. No voice audio. You can't hear me, Dr. Altaf. Everybody kindly mute yourself if you're not speaking. And Dr. Altaf, can you hear me now? You're not here now? Dr. Altaf, can you hear me? Dr. Altaf, you did not connect to the audio. You need to connect to the audio. Okay. Okay, fine. Then I'll go back to the notes. Okay. So this is the usual thing. We'll have classes on Saturday and Sunday, and then we'll do. So what are the materials required? So normally what are the materials required are, in general, I'm saying only for my classes. Okay. So for my classes, mostly science of pediatrics, illustrated textbook, plus guidelines, all this combined, I make a PDF. Because what I feel is that if you have opted for a class and you're opening 3, 4, 5 books, it becomes very difficult for you. Okay, so I make a PDF usually, so you can follow the PDF and skip the others. Even the guidelines I will include in the PDF. Plus, the clinical cases book are completely separate. Clinical cases are system wise. Those are 2 books. So in general, I'll give you all the books as well if you want to refer, but PDF will be given after each class plus the clinical cases book. Okay, and then we'll have the recalls. Now, somebody asked me, what is recall? What is past test? Okay. Recalls are basically past year papers. Okay. These are the papers some generous people after completing the exam, they came and they have written what are the questions that came in exam, and they were really brilliant people. And this is the best source because you're not supposed to take a picture and there is no source. You will get the past picture from the RCPCH website. Okay. Now, past test, about past test, some people do prefer past test, but I don't think so. It's very useful. I don't like using past test. You can use for like, for practicing. It's good, it's knowledgeable, but it's not required for the exam. It's not compulsory. So forget about past test. No need to waste your money and buy the subscription. Okay. So today I mainly conducted the class that how we are going to start from tomorrow. So tomorrow we are going to start with the endocrine class. Okay. Each system, major system, I complete in 2 days. 1 day is not enough for one system. Okay. So endocrine will have class on Saturday plus class on Sunday. Both these classes will be on endocrine. And after class on Sunday, I'm going to discuss the recalls of endocrine. That is, we will discuss the recalls of every system after the end of it. Because whatever you have studied, you must have an idea that what you studied, is it correlating with the questions or not? Otherwise, simply just studying the question, studying the topics, and you don't know how to, frame the questions, you don't know how the framing is done, you don't know how to solve the question, that's not very useful. So we'll do Saturday, Sunday class, and on the Sunday itself, we'll do the recalls of endocrine. Okay. Clinical cases, there are separate class for clinical that we'll study later. Now, Saturday, Sunday is your endocrine. On Friday, you're going to have a mock test on endocrine system. Okay. This is the thing. Now, there are clinical cases of TAS and clinical cases of FOP. There are two options. One is that, let me see. Okay, thank you. Okay. So clinical cases of FOP and TAS will have 10 classes to solve this. In between also, somebody please mute yourself if you're not speaking, dear. Okay, we'll have 10 separate classes to solve this. But what I would suggest you is that with each system, try to read the cases. If you do not read also, we'll solve in class. And if you have any difficulty, we'll solve in class. We have 10 classes allotted solely to clinical cases, TAS and FOP, which is more than enough. We are going to finish all the cases. Okay. So this is how we'll be doing each class. And after finishing the major systems, that is after finishing first 4 systems, we are going to have mock test. What I realized is that in my first batch, I gave mock with the whole portion. And then I gave mock with the major systems. What I realized when I give the whole portion, they find it very difficult. They don't do very well. But when I give mock with only say 5 systems, 6 systems, they do very good. So I realized that actually giving mocks, like whole system mocks, all the system mocks, I'll give them at the end. I'll divide all the systems into 3-4 parts, like say 4 system, 5 system, and I will take multiple mocks. In that way, they will be more focused on small portions. And then overall, by the time we complete the preparation by end of December and beginning of January, they'll be completely ready for big mocks. Okay. So this is, we'll have about, I think 4 mocks. I'm planning for 4 mocks for this batch, apart from the weekly mocks. Okay. Now, when you're studying, how will you study? What should be your method of studying? One thing is that if you have recorded classes, the disadvantage is that you become very lazy, or say where you tend to procrastinate and you tend to delay it, like, okay, it's there, I will do it. But try to completely stick to the schedule. Since I'm conducting the classes on Saturday and Sunday, it's actually weekend. I know weekend is a family time, but you can take some time for yourself and then do this since you have enrolled. If you're not exactly present in the live class, you can go for recorded class. But what I would suggest is that always join the live class, because when you join live class, it's more interactive. You can ask the teacher, you can even, I get to learn so many things from everybody in live class. We talk a lot and everything. It's really good. So live class, you'll feel a bit energetic. In recorded class, what happens is that to sit for 3 hours continuously, or say 2.5 hours continuously, becomes very difficult. So I would suggest you join the live class unless there is a huge timeline issue. Okay. And then after the class, what are you going to do? Saturday, Sunday is your class. Then you have Monday, Tuesday, Wednesday, Thursday, Friday. These 5 days is for you to finish these 2 classes. That means you will have 5 days to finish all these classes along with the recalls that is solved. And then Friday at night, you will get the test. So this will become your complete preparation. In this way, you will have a time frame in your mind that by this week, I need to complete all the classes. And trust me, even if it is the toughest of the, like if it is the most toughest system, say something that needs a lot of memorization, for example, pharma, you don't need more than 4 to 5 days. That should be your target. If you extend it to more, then it's going to take more time. Okay. So this is how we are going to proceed. So you attend the class. Okay. First is you attend class. After class, you check the PDF. Okay. Usually I include all the, as I said, Science of Pediatrics, illustrated and guidelines, everything will be compiled in PDF. So you do not need to open the books, but I always recommend seeing the books because there are some pictures that are really important. You must be familiar with the books, Just see the pictures, say, pick the smallest book and see the pictures and everything. After PDF, if you want to, if you have a look at it, you can go through the clinical cases. Otherwise, we have separate class after finishing our system. After that, you go through the recalls. This is your...
Sorry, doctor, your audio is getting distorted.
Sorry?
No, now it's better. In between, your audio got distorted.
Okay. So this is, we'll join the classes. Either you do live class or you do the recorded class, then you do the PDF at home and do recalls. I don't think so. Studying after doing this class plus doing a PDF and recall should take you 5 days, right? But since this is for busy doctors, I assume by 5 days, we will be able to finish everything. So Friday will be the mock test. You'll be given Friday night. You can sit by yourself. You can do it. You'll submit the answers. Okay. If somebody is not ready for it, then do not give. Okay. There are some people who have joined. Okay. If you're not ready for the mock, that's totally fine. We are all are adults. But if you have a mock, you'll always have something in your mind. You'll always have a target that you need to at least study something for the mock. Okay. So this was about the thing. Now let me show you the... Okay. The screen is visible?
Yes, it is visible.
Okay. So see, August 6th and 7th, these are class. So 6th and 7th, we'll have endocrine system. All right. Then we have 3rd and 4th, means every Saturday and Sunday I have taken. Okay. Saturday, Sunday, this is Saturday, Sunday endocrine class. Then you'll have Friday mock on endocrine. This also 13, 14, Saturday, Sunday nephro class. The next following Friday, you will have the mock. This way, see, by September, how many major systems are you completing? Endocrine, nephro, GIT, hemato, neuro, cardio, respiratory infection. You're completing 1, 2, 3, 4, 6, 7, 8. 8 major systems. And I always keep a mock after the major systems. Because I always think major systems, if you once you complete, you become very confident. Even in my current batch, I have taken mock from the major system and I've taken a test for out of 50. And I think there were only 2 people who got less than 25. All of them scored above 30. That is because it's a small portion, only 5, 6 system or 6, I think 5 systems were there. And they were major systems, endocrine, neurology, nephrology, hematology, all this, respiratory, cardio. So they did really well. That is not because of anything, because it was small portions. It was easy for them to study more. Okay. So we'll have our first mock test on 30th of September after 2 months. Then again, now we are going to solve from October onwards, we'll be solving minor classes, minor systems. See, you will see August and September, the classes are each system 2 days is needed, right? But in October, see, we have the minor systems. Usually 1 class is more than enough, including the recalls. All classes will be taught along with the recalls system wise for both TAS and FOP. Okay. Pharmacology only I have taken 2 days because I will prefer 1 day for teaching and 1 day for Viva. Even in my current batch, first day pharma we did in 1 class, and today we had another class, and for some time we just made a rapid fire session because pharma is all about memorizing. You should be able to memorize fast. So this will be, then in October we'll finish our minor systems. Everything is okay. By the beginning of November, we finish all the systems. This will be our second mock test. So first mock test is all the major system. Second mock test is all the small systems. I'm not saying they are unimportant. See, palliative, ethics, statistics, genetics, all these are very important chapters, but they are small. You can easily cover them. Okay. So these are small systems. The second mock test will be on 13th of November. Then we'll have, see, from 13th of November, till December 18th, all the classes, I have kept almost 10 classes for the discussion of clinical cases. Now, what I have seen, observed is that if I tell them the doctors in my class, just a minute, let me check if there is people waiting. Okay. If I tell them that read the clinical cases, what they assume is that they want to solve the clinical cases. But there is a difference between reading and solving. Your idea is not to solve. You don't want to solve. That's not important. The idea, you want to read whatever the explanation they have given. These are official books from the RCPCH website. These are their books. We have to take them seriously. Okay. And these are very good cases, excellent cases. Once you discuss one case, you'll become so clear about many topics. So clinical cases discussion, I think I have some videos as well on clinical cases discussion. So I have kept 10 classes solely for clinical cases discussion. Only reading is pretty easy. You can finish it in 10 minutes. But when you're discussing one case, minimum it's going to take 30. If you're very fast, it's going to take 30 minutes. So I've kept 10 classes for the clinical cases discussion. And here, if everybody is okay, I'll keep a mock on the clinical cases. Because for FOP, you see the clinical cases, once you read, it's okay. But for TAS, always they have unpredictable questions. And the clinical cases really help a lot. So the clinical cases we'll be studying in this time. Then here, this 24, 25, 31 December, this we are going to do year-wise recall. So after every class, we will do system-wise recall, right? But we need to see overall how the questions come. So we'll do year-wise recalls. Each day will take about 2 to 3 hours class, and there will be 3 classes. And of course, after each mock test, as I said here, there will be a discussion class. Then on January 8th, third mock test, and January 21, fourth mock test. This will be on completely all the portions, and there will be a discussion class following this. So you give the test on 8th, then on 10th, say, I'm going to do a discussion class. You give the test on 21, on 22, I'm going to have a discussion class. Because if you give the mock, you have made some mistake, but it's not discussed, then you're like completely lost. You have made a mistake, you're going to repeat the mistake, right? So by January 21, you're completely ready, and February smoothly. If you follow this, even if you join my class or not, if you follow this, I'm telling you, inshallah, you're going to pass the exam if you're sincere with it, because it's always 50-50. It's never only I give you the notes and that does not work out. You have to use your brain, right? So this is about it. And see, up to October, there will be mock on every Friday. That is topic that will be taught on Saturday and Sunday. System-wise recall will be done along with every system, and recalls will be solved, plus 3 extra classes, this for year-wise recall. Okay. Mock 3 and mock 4 will be followed by a discussion class, because mock 3 and mock 4 will be completely like exam, like how FOP TAS exam is given. Whole FOP exam separate, whole TAS exam separate. Like that I'm going to conduct. Okay. So you'll become a bit used to it, and whatever problems are done, you go to discuss a lot. Okay. So that is our plan so far. So we'll start tomorrow. So, please mute yourself if you're not speaking. So we'll start tomorrow, and if you guys have any doubts or any questions, okay. Still no. I think Dr. Altaf, my voice is, I hope it's clear with everybody.
No.
Is it clear? Is the voice clear?
Yes.
Okay, I think Dr. Altaf, I think something is wrong with your network or something. Please check. Okay. Okay, okay. Okay, okay. Okay, you guys have any doubts? Any doubts, anything you want to ask?
I have a question.
Okay, who's this?
This is Elizabeth.
Okay, tell me.
So my question is about the MRCPCH. Are you required to have an IELTS exam before sitting for the MRCPH?
I'll get back to you. So this was the basic introduction class. I'll end the recording now and I'll get back to you. Okay, just a minute.